Hello, everyone, and welcome to our webinar, COVID-19 Testing Options. I'm Jennifer Koenig with Health Check 360. We have a great presentation for you, but before we get started, I'd like to take care of a few housekeeping items. We will have time for questions at the end of this presentation, so if you have any questions, just type them into the question box at the bottom of your screen. We will also be posting a recording of the webinar online, so if you would like to replay this presentation at a later date, it will be available. Today we have Health Check 360's Jessica, Mandot, and Tim Johnstad with us to break down all of the testing options available today, what you should be considering when implementing COVID-19 testing with your workforce, and how testing can keep employees safe and healthy. With that, let's go ahead and get started. Jessica, Health Check 360 has a lot of new solutions available for companies to help them address COVID-19 challenges. Can you give us an overview of what return to work options are available?
Yeah, definitely, Jen. So you'll see that there are a lot of things to be considering and a lot of different options on the marketplace right now regarding return to work strategies or keeping a healthy and safe environment for your workplace. And so one of them being a daily symptom tracker with our ability to track symptoms of our employees on a daily basis. We're seeing more and more states start to open that up as a mandated requirement for going into the office. So you'll see that to be a very popular item. Temperature screening. So lots and lots of companies are talking about requiring employees to take their daily temperature reading. So whether it's an on-site screening option or whether they're providing temperature and thermometers to all of their employees to self-report their temperatures, that's kind of a really hot topic right now. COVID-19 case management is kind of that next step. So if you do have symptoms or you do have a high temperature reading, what happens at that point? Where do we direct employees or what type of support can we provide to them? Testing options. So that's where we'll spend the majority of today. But really, what are the testing options that are out there right now? Which ones require an ordering physician? Which ones are employers able to get their hands on and employees access to? So like I said, we'll spend a majority of our time today specifically on the testing component. And then more and more information is coming out specific to how comorbidities and conditions like diabetes and hypertension are impacting individuals that do have the virus COVID-19. And so having a solution in place to support individuals that do have chronic conditions, that's kind of another hot topic right now.
Jessica, why do employers even need to be considering testing and testing options as part of their COVID-19 workplace strategy?
Yeah, so I think number one, the goal is to keep employees healthy, to limit exposure, limit the spread of COVID-19. So number one, if we're going to have employees around each other and coming into the office, whatever that might look like for your organization, making sure that we're doing everything in our power to mitigate any risk that comes along with that. So if we are having employees work together, making sure that we can identify potentially who is at further risk or who has already built up some sort of antibodies, who's currently carrying the virus, those types of things specific to testing options. But making sure that we're keeping employees healthy and safe and that mitigating as much of that risk as we possibly can. I think from a compliance standpoint, the EEOC and some states, they're allowing the employers to provide these temperature readings, these on-site testing, or just testing options in general. And so from a privacy perspective, some of those regulations that we typically have to adhere to under HIPAA have been modified to ensure a safe workforce for your employees. We might see a little bit of that change as well. And then I think the other thing is employee morale. So we've seen that for companies that are starting to implement some of these solutions, employees are extremely grateful for it. They are nervous about coming back to work. They're nervous about being around individuals that they haven't been for the last few weeks. And so for them, the employee satisfaction and really ensuring that they feel safe, not just that we are instilling certain measures to keep them safe, but that they feel safe as well. So I think there's a couple things to consider. And then we're starting to see that more and more states are mandating certain requirements if companies are opening up. So you may see, I think New York State has some regulations that they're putting in place in terms of what's mandated versus what's recommended when opening up. But you'll start to see that some of the states are saying that if you are going to bring employees back into a working environment where they are working together, there might be a daily symptom tracker, there may be temperature requirements, those types of things. So you might see more of that as states start to open up and things come back to whatever this new normal is.
Tim, anything to add on that?
Yeah, you know, it's interesting. A lot of things are unfolding in this space, just as they are with all things COVID. And the CDC has actually come out with some guidelines over the past couple of weeks. I'm sure many people have already seen them. It's a pretty nice little flow chart. They've also got some 70-page long documents to go along with this. But it's fairly straightforward, and it does kind of spell out a nice step-by-step process for employers to think about as they're looking at return-to-work strategies. First and foremost, it's pretty straightforward. If people are sick, they should feel sick, they should stay home. And the CDC recommends putting a program in place at the employer level to monitor those employees on a daily basis to see if they're feeling sick and should stay home. So some good support out there with the CDC for these types of programs as well.
Tim, there's a lot of testing options available today, and it seems like it's growing by the day. Can you give us an overview of some of the testing options that are available?
Gladly. The growth on a daily basis is absolutely true. It started off, I think, back in February. There were really no COVID tests available in the United States, and now we've got 3 different options. And it gets a little confusing, so I'll try to break it down pretty quickly here, and we'll dive into some details on each of them. But the PCR test is the first one to come on the market. That's the one. It's a nasal swab test. It is really good for active infections. We'll spend a little bit more time talking about that in a second, but it's really available mostly through hospitals or some of those state-run or public health-run drive-through testing stations. The second option, which we see all over the news, there are literally hundreds of these tests available out there in the market. It's the antibody test. And I think the antibody test can provide some really good data points to those groups or potentially populations that have had a fairly high percentage of people that have been exposed to COVID-19. But it also comes with some pretty significant limitations and concerns. Quality is also all over the board across those 300 or so tests that are available. And so we spent a lot of time talking about that internally here. And we'll dive into that in some detail here in just a moment as well. The third option is the brand new option as of May 9th, actually, so just a couple weeks old. The FDA approved what's called an antigen test. So it's similar to the PCR test in that it's good for diagnosing active infections. But it's a faster turnaround time and a little bit more scalable. There are some quality concerns. Quality is still developing in the antigen test space, but I think over time we will see that improve, and the cost will come down accordingly. So it's definitely a place to watch.
Tim, I know I've personally heard a lot of stuff in the news lately about PCR testing. Can you speak a little bit to what that all entails and what employers should be considering around this testing option?
Definitely. So PCR testing, as mentioned, is good for diagnosing active infections. And unfortunately, the access to the test has been very limited up until pretty recent past. And frankly, the access is still not to where it needs to be. And so we are not at a place as an industry yet where 100% of the population can go out and get a test to see if they have an active infection of COVID-19. We're just not there. We currently, as an industry, I think we're doing about 400,000 tests a day. And so that means most of these PCR tests are still managed through the hospitals, through the ordering physicians, and through the state public health agencies. So there are some really exciting and interesting things to watch related to PCR tests from an employer perspective, especially as a return to work strategy, because it is so good at diagnosing an active infection. And when somebody obviously tests positive, we can identify them and keep them home and avoid exposing them to other employees or others in the public, and thereby increasing the infection rate. So PCR testing is something that we're helping some groups access right now as Health Check 360. And it's really groups that have a high number of essential workers. So meatpacking plants, as an example. We have a couple of those that I've talked to over the past couple of weeks that are really trying to access the tests and trying to figure out how to do it. And so I put them in touch with some various labs around the country and help them get that access. So if there is a group that has a large number or high percentage of essential workers, that might be of interest. Another type of employer that could be interested is a group that has a high number of employees or a high percentage of the local population that has had a previous exposure to COVID-19. So again, that could be another area where an employer could be interested in PCR testing. So the volume there, the access is still unfolding, and we've got some good momentum as a lab industry. I think over the next couple of weeks, things will continue to improve even more. But right now, they are available, as I mentioned, only through the local providers and hospitals, maybe through some of the local and state health agencies.
What about antibody testing? Because this one sounds really interesting and it's gotten a lot of traction, I would say, in the news lately. What do employers need to be considering about that option? Because it seems like a really good one. Yeah,
it does. And we've spent a lot of time on this over the past 2 months, frankly. So the test is different than the PCR. The antibody test is different than the PCR test in that it cannot tell us when there's an active infection, but it can tell us when there was a past infection. And so it usually takes about 7 to 11 days after the infection for the body to develop what they call IgG antibodies. And that's a sign that we've been exposed. When that test comes back positive for IgG antibodies, that's a sign that we've been exposed to the COVID-19 virus. What we don't know is what level of immunity that previous exposure provides us as an individual. So it might be, that we do have some immunity. It might be that we have a week's, we're immune for another week. It might be for a year. It might be for the rest of our lives. The science isn't settled on that yet. So that's an open question and frankly a challenge related to the antibody testing. While there are some good quality tests out there, we just don't know what to do with the information when the result of the test comes back. So antibody testing may be really good for some groups. Probably doesn't make sense for everybody at this stage. Just again, because we don't fully know what to do with the information when the test result does come back. So 2 things I really want to mention about the antibody testing beyond that. Number 1 is quality matters. As I mentioned, there are 300 plus antibody tests out there in the market. The quality of those tests is all over the board. Some of them produce false negative or false positives rates that exceed the actual percentage of positive people with COVID-19 in the country. So that could be really bad if somebody gets a false positive result, thinks they had COVID-19 2 weeks ago or more, and they go out and start interacting with the community. They don't have that potential immunity built up because that antibody test came back as a false positive. So therefore, they actually catch it and maybe expose themselves or others to COVID-19. So quality absolutely matters. Not every antibody test is created equal. We've spent a lot of time working with various academic labs around the country, including the University of Washington, to identify some of the best tests out there. We're confident at this point, the science is supporting this as well, that the Abbott antibody test is of the highest quality. And so we are focused on helping our clients when they need the antibody testing to access that Abbott testing. So the second thing is, again, who needs the test? Because we don't know, what to do with the results when we get the results of the antibody test. So who should actually get these tests? And it might make sense for groups very similar to the PCR test that have had a known exposure or a large percentage of their population exposed to COVID-19. We might be able to start to build some return to work strategies based off the results of the antibody test, particularly when you can have some confidence in the quality of the antibody test like you can with the Abbott test. So Health Check 360 does have a program in place to help access those Abbott tests. We can help schedule those tests on the group's behalf, as well as provide access to the results and make sure that folks understand what the results mean when the results come back.
Hey Tim, can you tell us a little bit more about Health Check 360's offering for antibody testing?
Certainly. We've worked with a lot of these 309 or more at this point antibody labs out there to evaluate some of the best lab solutions for antibody testing. We are very pleased to have developed a partnership featuring that Abbott high quality test that we mentioned as providing good access, if not great access to that test to our employer groups where it makes sense. And that access is actually provided through LabCorp. So LabCorp does the test processing, and we can either set up an on-site blood draw clinic for groups of 20 employees or more, or we could direct individual employees or smaller groups to one of the LabCorp patient service centers, of which there are more than 2,000 around the country. So we feel really good about the quality of the test with the Abbott test. The access with the test is great because of our partnership with LabCorp. And we're able to do this at a cost of $109 per test, which we think is a really great cost. And that does include all of the scheduling and coordination, as well as the test draw, the test processing, and the results management. So we're really pleased with this offering, and our groups are finding it really helpful. Again, where antibody testing makes sense, we think that this is a good program.
Awesome, thank you. Tim, anything else to add around testing?
Yeah, it's such a fascinating space and changing by the day. You know, we touched earlier on that antigen testing, and that's definitely a space to watch because it will improve the efficiency and access to the basically the diagnostic test. And so it will allow us to test on a much faster basis the people who have active symptoms. It won't be perfect because it still requires centralized processing of some sort of a test. So it's still a nasal swab, and then that swab is sent to a centralized processing facility. But rather than like the PCR test, where that takes 6 to 8 hours to run, as I understand it, the antigen test only takes 15 minutes on the machine. So much faster, much higher throughput, and it's definitely a space to watch. And to that end, there are a couple of other exciting innovations that we're definitely keeping tabs on. And I think the Health Check 360 team will be offering some additional benefits or some additional services here related to testing here very soon. And that is at-home testing. And so there are two different companies that we're closely following. And one was recently approved by the FDA for an at-home nasal swab test kit. But again, it does require sending that sample back to a centralized lab for processing, but it can be done at home. So we don't have to send a symptomatic person into the office or to the hospital to do that sample collection. It can be done by the individual at home and then mailed or FedEx back in to the lab. So that's a really exciting innovation, and we're working closely with that lab to watch that unfold as their capacity expands. The second is a lab on the West Coast that we're closely working with that is developing a very high quality saliva-based diagnostic test. And so that would basically allow individuals to get a sample tube at home, put a little saliva into that tube, mail it back to the centralized lab, and again, overnight processing, they would be able to see on a pretty rapid basis what if they're positive or negative for an active infection of COVID-19. So that's both of those we think are pretty exciting and something to watch for potential employer solutions because they allow a lot more scalability to the diagnostic test, and then couple that with the good offering that we already have on the antibody test, and we think that there could be some interesting options for employers going forward.
Jessica, what other things should companies be considering when evaluating their COVID-19 strategy and testing options?
Yeah, we talked about this kind of in different components throughout the presentation so far, but you always want to be assessing your risk, and doing everything you can to mitigate those risks. So Tim had mentioned quality of tests. You're going to see lots and lots of different options and different manufacturers of the tests. So I think one of the biggest thing to consider is really what that quality is, because you want to limit the amount of false positives or false negatives as much as you can. Another thing is going to be the storing of those results. So who all is getting access to the results? How are they receiving them? What you as the employer has access to. So again, thinking about all of those different components. Logistics for the event. So when you set up, if you are deciding to do some sort of on-site testing option for employees, you want to think about the logistics of that. Can you provide that event while still complying with social distancing? So how do you set that up so that to ensure employees are still 6 feet away, that they're wearing masks, that there's the appropriate, equipment involved? A lot of the testing options do provide PPE equipment for the examiners that are completing those tests, but do you want to supply masks or those types of things, antibacterial for the employees to have access to? Same thing with scheduling of the events. So you'll be able to determine how long you want the event to go. But within that, making sure that employees are adhering to their scheduled times and coming, not coming early for their appointment time. So thinking about the logistics of how that can actually successfully be run at your organization. I talked about this a little bit earlier, but employee morale it's a real thing. It's very, it's extremely important right now. We're at a time where people feel uncertain and unsure of what's going on. They're nervous about going back into a working environment, seeing people that they haven't been exposed to previously. So it's new for everyone. And I think the more that you can communicate and address that with employees, the more comfortable they'll feel with all of this. So really, why are we doing this? What value does this testing provide to the employee? Helping them be a part of the process and really understand, what it is that these test results mean and why you're completing that and how you can support those employees. Addressing privacy, so knowing that some of the information, you will have access to those test results as the employer. So addressing that with the employee, exactly what you will be receiving and what they will be receiving always helps reduce any of that concern or what's unknown out there. And then Tim had talked a lot about this, but how are you going to utilize that data? So does it make sense for your organization to roll out the antibody testing just as a baseline and a nice to have? Is it required for employees, or is it just something that, again, is more information for them? So basically thinking about what you're going to do after you found out these test results and how that's going to help you drive your decisions within your company.
Jessica, Tim, what are the next steps for companies? What do they do with this information and where do they go from here?
Yeah. So I had kind of spoken about this a little bit just there, but thinking a lot about how do you use that data? So like I mentioned, is it something that's nice to know? Is it that the results are going to determine who's coming into the office, how often they're coming in, who's in phase one? Maybe for anyone who maybe you test everyone on the antibodies, and then depending on who has them is determined for phase one or phase two of going back to work. Tim had mentioned that for some organizations, it doesn't make sense to test everyone, and it just makes sense to keep majority of the employees working from home besides the essential individuals that do need to be in the office, and maybe you just test that portion of the population. So again, thinking about how this can really impact your return to work strategy and what you're going to do with that information. The other thing that you want to consider is how often are you going to be testing? Is it just a one-time thing? Is it once today and another time a month from now? Is it before each phase starts for your strategy? So all things that we want you to consider, but knowing that this is changing very quickly in terms of the different options that are available. Tim, did you have anything you wanted to add to that?
Yeah, I think you nailed it, Jess. And the only other thing I'll say is that testing is one component of a good strategy from an employer perspective, at least as we see it. Testing right now is imperfect no matter how you look at it. I think it's better than it was a month ago, and it will be better in a month than where it is today. But it's there are some basic blocking and tackling moves that an employer can make now, even before considering testing. And then testing might make sense for some, and for others it might not. Those blocking and tackling moves, whether it's daily symptom checking, temperature screening, that kind of thing, is definitely a place to start, and Health Check 360 can provide services there, in addition to testing where it makes sense.
Great. Thank you both for your time today and for sharing your expertise. We'd now like to open it up to our audience to ask a few questions. If you have any questions, please type them into the question box at the bottom of your screen. And in the meantime, be sure to sign up for next week's webinar to see a demo of the COVID-19 symptom tracker and admin portal, and subscribe to our blog for the latest on Health Check 360. Jessica, you and Tim actually both mentioned early on that testing is just one component of an overall strategy. Can you summarize again what the other components are that employers maybe should consider as part of that overall COVID-19 strategy?
Sure. Thanks, Jen. I think that there's a lot of conversations around testing. As Tim mentioned, it is changing every single day. We have a number of leads out there for multiple options that are coming out in the future. So that's something that we'll keep everyone posted on. I'm seeing that a lot of companies are talking about testing. They're keeping it on their radar, but it's something that it's kind of a wait and see type of thing at this point for the majority of companies out there. But I will say the one that everyone's talking about and kind of the phase one approach that they're looking at is a daily symptom tracker, especially as more and more states are starting to require and mandate certain components like a health assessment of some sort. So that's probably taking up the majority of our conversations right now, is what options we have for the daily symptom tracker, what it looks like, what the administrative capabilities are, that type of thing. I think from the very beginning, one of the first solutions that was out there was temperature readings. So whether that's on-site readings or providing thermometers for your employees, we're still seeing that be a hot topic. I think more companies are just trying to figure out what that looks like for them, and logistically how that makes sense, and financially if it makes sense, and how to make the best decision for their company. The case management piece answers a lot of questions around what next. So we know that people have symptoms. We know that they're testing positive for the antibodies, or that they have tested positive for COVID-19. What type of additional support can we support them with outside of HR's standard role within the company? It's not HR's area of expertise. So what additional support can we provide them that is more clinical than from the employer level? So I would say those are kind of the big ones, and the major talking points that our teams are having with employers.
Tim, I think this question is for you. There's been reports of about half of antibody tests being inaccurate. Does Health Check 360's tests fall into this category? Are there other reasons that you could test positive with IgG antibodies?
Yeah, great question. And the news just changes literally by the day, if not even the hour, with the antibody testing. So it is true that you could consider half of the tests, at least in the antibody testing segment, to have quality concerns. So in the lab world, the quality measures are what are known as specificity and sensitivity. And that basically is the false positive rate and the false negative rate, actually the inverse of that. But those rates are the true measures. And so that's why we're pretty confident with the Abbott test being among the highest quality tests. Their specificity and sensitivity are up close to 100%, whereas others are in the 85 to 90%, which doesn't sound like that big of a difference, but that's orders of magnitude worse than 100% specific and sensitive test. So quality absolutely matters. And you're seeing news, if you just Google antibody tests in the last 24 hours, you'll see news about tests that produce, more false positives than maybe even true positives. And that's a concern. So quality matters. And if the test is going to be used, absolutely make sure it's the right test. And that's why we think, Abbott and one or two of the other manufacturers are the right way to go. To your question on the reasons that an IgG test might show up as positive, it's called cross-reactivity. And yes, a lot of these tests do have the opportunity to show cross-reactive positive results based on a previous coronavirus experience, not COVID-19, but another SARS-like COVID or coronavirus infection could trigger a positive result on some of these tests. And so, again, just another data point to show that quality matters. And frankly, use all of these antibody tests with caution at this point. And so I think that's the bottom line message.
All right, next question. Are there any record retention policies that we should keep in mind when it comes to testing?
So, Jess, you're probably more familiar with this than I am, but obviously the standards have come out from the EEOC as well as OSHA and some of the other government organizations. And as I understand it, they're actually recommending that the files be held separately from the HR files. In terms of the record retention, Jess, maybe you have that information off the top of your head. I don't know that answer.
Yeah, I think our recommendation for that is that we don't know how long this is going to last. And as far as obtaining this information and any of these return to work strategies, really, the goal is, number one, to keep your employees healthy and safe. But then also, number two, making sure that from a liability standpoint, you're able to have records of certain things and the things that you have put in place, the policies you have in place. So our recommendation is that at this point, we don't know exactly how long you're going to need to keep this information, but as long as coronavirus is a concern and something that we all need to be taking into consideration, that's kind of the length that you should be thinking about holding on to these records for at this point.
All right, next question. Are insurance companies paying for this type of testing?
We get this one a lot. Tim, I'll let you take that.
Sure, the answer is yes. So each of these tests is reimbursable by Medicare and by the commercial insurance companies when it's diagnosed appropriately or when it is accompanied by the appropriate diagnosis. And there are some other kind of standard EDI or electronic data interchange billing requirements that have to be met. So when they're ordered through an ordering physician, through a hospital, et cetera, the answer is yes. Our program is mostly set up as a direct employer relationship and just to facilitate ease of access there. But the answer is yes, these are reimbursable by insurance.
Jessica, you mentioned temperature screenings a few minutes ago. Is that something that Health Check 360 can help with?
Yeah, we actually partner with a company called eHealth Screenings to be able to provide on-site temperature readings for companies that are looking for that solution. So we do have a solution in place that is accessible for companies.
Okay. Another follow-up question. Do we have relationships with somebody who would help with scripts for the order to be covered? I think this is related to the coverage question, Tim.
So we have had this question a lot, and it really depends on the circumstances. So I'm not going to say no because I don't know what the circumstances are, and it's very likely that we could figure something out. On the PCR test, where we facilitated access to those, it has been through an ordering provider. And even on the antibody test, and there are some options there as well. So we can, that's something we can definitely address kind of on a one-off basis or one-to-one basis.
Great, thank you. Would this service be useful for colleges or universities who want to bring students back to campus?
We've gotten a lot of requests in university settings, school districts, those types where I think that I think there's a couple things to think about in those industries. I don't know necessarily that antibody testing is the right option. Thinking about the demographic of who COVID-19 is impacting the most, it tends to be, over the age of 40, as well as individuals that are higher risk. So from a testing perspective, I'm not getting a lot of questions around, are we going to mass test all of our students before we come back to, I'll use where we are right now, the University of Iowa. But certain strategies like the daily symptom tracker, having the students check in on a daily basis what their symptoms are so that they can track them and that the university board can track them. That is a lot of the conversations that we're having. I know there's been a couple of conversations from school districts around, do the parents check their students in before they go, into 7th or 8th grade type of thing. So there are conversations. I think that which of these strategies make sense is a little bit different for universities than it would for the rest of, manufacturing or professional services industries. Tim, again, anything to add there?
No, I think, the antibody testing, as a end-all be-all on its own is probably not a real good solution, which aligns actually with the latest CDC guidance. They're recommending against using antibody test unless it's very specific situations as a standalone return to work solution. So as the PCR test, however, and as that new antigen test becomes more readily available in the market, and by extension, the cost will come down, it could become a little bit more interesting to consider. But as of today, the capacity just isn't there for the PCR test to do it in scale. And the antibody test, given that it's not a diagnostic tool and there are some limitations, it really takes the right situation, that being a highly dense or a density of infections for there to be enough value for it to make sense.
Great. Thank you so much, both of you, today for your time. That concludes our presentation. I hope everyone enjoyed the presentation today. All attendees will receive a follow-up email with links to the presentation recording and contact information. And as a reminder, we have another webinar coming up next week showcasing our COVID-19 daily symptom tracker and administrator portal. If you're not already registered for this webinar, you can access the link on our blog, on our website, and on our LinkedIn page. This concludes today's webinar. Stay safe, stay healthy, and have a great day.